everyone, my name is Mike Lang and I'm a researcher and patient educator with CancerControl Alberta, as well as being a cancer survivor myself. Fatigue was one of the things that I struggled with most when I was going through my own cancer treatments, and that's why I'm really glad I get to walk you through this video series, Living Well with Cancer-Related Fatigue. It was created through a partnership between the provincial cancer agencies of Alberta, Saskatchewan, and Manitoba. In these 7 videos, you'll get to meet 2 people who have been diagnosed with cancer, Ed and Sandy. They will share their story of how fatigue has impacted their lives, as well as all the things they are doing to live well despite the challenges they are facing. You will also get to hear from a number of healthcare professionals who will give you some great tips and tools to help you manage your fatigue so that you can still do the things that matter most to you. So, let's get going and meet Ed and Sandy.
Well, my great-grandfather started farming, and we farmed for many years, and farming is really in our blood. One thing is very clear to me is the smell of the earth was, and then also the idea of feeding the world. It was a big thing for me. When I look back, it was amazing.
I'm from the prairies. I'm from Regina. I like it out here. I like the sun. I like the cowboy life, simple life. I would say that I'm very fortunate. I have a wonderful, healthy family. I have my 2 children. My son's 31, my daughter's 25, and I have a beautiful granddaughter that's 4.5, Lily, and I never stop talking about her. And I've always worked all my life. I always did extra jobs on the side. That's just been my sort of thing most of my life. And then just in 2014 was when I got diagnosed with breast cancer that had spread to my bones. So I'm not working anymore, needless to say. The diagnosis actually was on my granddaughter's birthday, on her 3rd birthday. So that'll stay.
I was coughing a lot, and Laura wanted me to go and get it checked out. And so then I got it checked out in the fall, never thinking that anything was wrong. I went to see the surgeon after all the tests. And he said it had to come out, and I was going to go have my lung cancer surgery. After the treatments, I was not well with this treatment side effects and the fatigue, and that was very difficult to figure out.
You know, I can only think that when I first experienced fatigue, I'd never had that in my life. And it's not, like I said, it's nothing like exhaustion. And so I think it kind of shocked me because literally the first time it hit, I was like, now what? Now how long is this going to last? Like, I'm almost incapacitated in many ways. I can't get up, I can't go anywhere, I can't do anything. It's just like forming a word after another seems like a lot of work. So yeah, that was in the beginning really strange.
In my practice, we see cancer-related fatigue regularly. Studies show that 70 to 90+% of patients will have cancer-related fatigue at some point in their journey. And in fact, many patients will say that it is one of the most, if not the most distressing symptom that they will experience during their journey.
The fatigue often becomes a fairly debilitating issue that's overwhelming. In addition to the physical fatigue, people experience a lot of mental fatigue. So ability to attend to mental tasks, focus, can be really difficult for them at times.
So I think one of the things that we want patients to know is that it's not a trivial element of what they're undergoing as a cancer patient. I think that when patients look at the inability to do even regular functions in their daily life, that's the impact that they need to tell us as healthcare providers so that we can understand how bad it is for them and maybe get a clue as to what elements of the fatigue we can work on.
With cancer-related fatigue, people often talk about it not improving with rest. So they might say, I sleep for many hours and yet I don't feel that when I wake up, I'm refreshed or restored.
It's fatigue that lasts a long time, is not related to activity, and does not get better with rest or sleep.
Is really feeling tired out of proportion to what you've done for that day or what you would expect. Say if you exercise and then you get fatigue, or you've had a busy day and then you get fatigue. Cancer-related fatigue is really the inability to do most of your activities you want to get done throughout the day.
So cancer-related fatigue has multiple causes, and people who are dealing with cancer as a chronic condition, there can be multiple factors that play into why they're having fatigue. The cancer disease itself can certainly contribute to fatigue. People who are going through cancer treatments, again, whether that's chemotherapy or radiation therapy or other types of therapies that they're engaged in, the side effects of those treatments can contribute significantly to cancer-related fatigue. And I'd say for the most part, there's not often one thing we can pinpoint that's causing somebody's fatigue, but it is multiple players.
The good news, I think, with fatigue is there's lots of things that we can do with lifestyle modifications to help. And so some common things would include exercise, optimizing diet, improving sleep, managing stress, getting support groups involved.
Realizing that, you didn't get sick and have chemotherapy overnight, so it's going to take you that same amount of time and even more to build back up the stamina to where you were before you got cancer. And so it's those expectations of a little bit every day and adding to that every day, but not expecting that, boom, I should be better because I'm finished with my cancer treatments, and so the fatigue should go away.
Patients should be aware that they're definitely not alone, and it can be very frustrating and debilitating. But with that being said, there are many things that your healthcare provider can do or that you can do with yourself and loved ones to help manage your fatigue.
Everyone's cancer experience is different, but we can still learn a lot from each other's stories. And that's why I'm really excited for you to get to learn about Ed and Sandy in addition to hearing some great information from cancer care professionals. You can watch the videos individually or in order because each video deals with a different topic. So if you would like to learn more about a particular topic, make sure you check out the booklet or ask your healthcare team. Well, that's it for the first video. So when you're ready, go ahead and watch Module 1 about finding support and being patient. I'll see you soon.